Alright, so the new age homeopath is usually dependent on thuja or cilicia for vaccination related troubles. But there was a time when Dr. Burnett, Dr. Clark, and all these renowned authors, they used remedies like variolinum, vaccininum, malandrinum, diphtherinum for ailments which developed after vaccination or old school drugging, or which were not better by old school. Today we'll take up Malandrinum, which is an interesting remedy, often forgotten by all homeopaths, often overlooked by many homeopaths because they have thuja, cilicia, and much dependence on these polycrest remedies. And the smaller remedy, which is Malandrinum, or the remedies that we discussed in the last 2-3 days, vaccininum, variolinum, diphtherinum, are often remedies that are forgotten. And the reason is that no one knows how to use them. How will you know how to use these smaller remedies, these lesser known remedies? The only option, perhaps maybe one of the option, is by going through the different cases which were resolved by these authors, which knew the remedy when the remedy was discovered. And Malandrinum is one such remedy. In Allen's keynotes, it is comprising of around 5 to 7 pages of remedy description. And there are 5 to 7 or more author quotations who have cured cases after cases of vaccination related troubles in their clinics, in their practice. How will you use Malandrinum? Let us see. The first thing that Allen mentions, or the revised book of Allen, which has been published by different publishers, it mentions confusion, lassitude of mental faculties, dread of any mental exertion, lack of concentration, and comprehension which is difficult. Similar to all the psychotic remedies that we know of, medorinum, thuja, even silica. So it's a combination of all these psychotic or psychosyphilitic remedies. And then you have melancholy with great fatigue, lassitude of mental faculties, lack of concentration, and dread of any mental exertion. So you see that all the symptoms that you read are mostly belonging to psychosyphilitic traits. Next you have is categorization, which the earlier keynotes didn't have, but the revised keynotes by a leading publisher has it. So I'll read as it is mentioned. The text will differ if you read any other book at your end, any other publisher at your end. But what you see in the head is that there is pustular eruption or itching of the scalp in various locations, and very less mention about any headache related ailment. This clearly indicates that the remedy actually acts on the skin rather than on the other aspects of nerves or pain related ailments. And when you have a symptom which is mentioned again and again in different parts. Like in Malandrinum, the symptom is mentioned in different locations, especially in the head, in the eye, in the mouth, in the back, in the skin, for pustular eruptions or changes in the skin structure. That is where we should know that this remedy will profoundly act on the skin rather than on the pain or the sensation level. Once you understand this, your job to prescribe this remedy becomes easier. You have a patient who is describing more of skin related complaints. Go ahead and think of these nosodes which are going to relieve the patient, because the trouble has been lurking in the background and again rearing its head out from the skin's manifestation. And the head is one such location for Malandrinum, where all sorts of eruptions are there. There is impetigo also. There is some sort of headache and backache, but along with that there is always the eruptions which is mentioned, and which is crusty and intense itching is there. Similar state we will find in cicuta, we will find in graphitis, we will find in sorinum. But over here Malandrinum is to be thought of when you have ailments from vaccination or never been well from vaccination. We always think of remedies which are thuja, cilicia, because we find comfort in those medicines. We know those medicines so well. But the secret to getting out of comfort zone is the success for all homeopaths. And once you start exploring these smaller remedies, these newer remedies, you will be in a better position to gain confidence and take your practice further. The more you limit yourself with 10 remedies, 20 remedies, 30 remedies, the more restricted your practice will be. You will never grow or outgrow the level which you are in. And for you to outgrow and exceed your own practice, you need to start thinking about these remedies. So next you have about Malandrinum is in the face and the ears. There is eczema facialis, purulent greenish yellowish discharge mixed with blood from the ears, and in the face there is eczema facialis, intense burning, much edema and oozing viscid fluid. Yellowish honeycomb like crust on the upper lip is found. We see this expression very strongly present in Natrum muriaticum. Upper lip or around the lip there are eruptions which are found. But those eruptions are mostly vesicular in nature. Malandrinum shows you pustular eruptions. Very fine differentiation. If you can find out, you will be in a better position to prescribe Malandrinum. Next you have is in the mouth. There was one case of Dr. H.S. Taylor who cured a stubborn case of aphthay using Malandrinum. So all those cases of aphthay which you seemingly are giving silicia and thuja and sulfur and there is no improvement, think of Malandrinum. If there is corners of the lips or the mouth which is affected, there is offensive mouth, similar picture like silicia, and there is recurrent aphthay which is there. Throat, you will have symptoms like lachesis, left side is affected and then the right side, and left tonsil is swollen, inflamed, and ulcerated sore throat is found. But it is non-significant because the majority of the symptoms are on the skin level. Teeth and gums, you will find offensive breath, there will be bleeding easily, and there will be gum affections which are recurrent present. Next you have gastrointestinal system, where you will have diarrhea or symptoms which are mostly similar to croton tig and aloes. So there is empty all gone sensation with faintness and trembling, not better by eating, though the desire for food is very marked. Pains around the umbilicus, which is very significant of aloes, croton tig and other gastric remedies, especially podophyllum also. And what you see is in Malandrinum, there is again, like in the mouth there was offensive smell, there is offensive flatus or offensive diarrhea which is excreted. Very interesting prescription of Malandrinum can be sought if you find a combination of symptoms of podophyllum, aloes and croton tig. Next you have is very few mentions about urinary male or female reproductive system, not so important. Especially the skin is affected with different types of eruptions. In the back you will find backache, and most of the complaints of all the skin remedies and all the remedies that are affected by vaccinations or who have pustules, especially if you see the remedy which is uh, antimtart, very important remedy to prescribe in chicken pox. If you have a viral case, it will take its time, it will take 7 days, but the complaints will be mitigated or reduced by antimtart, moxol, or any other indicated remedy. But antimtart, why I am telling in this connection of backache, is because it has pustular or vesicle eruptions with backache. Very strong indications for antimtart. And now you also know about malandrinum, very strong indications for intense backache with the pustular eruptions. Next you have is uh, on the skin. Again there is upper limbs and lower limbs, there is large blisters or deep raggeds, sore bleeding on the soles of the feet, and better in cold weather after bathing. And there is dry unhealthy skin which oozes lot of fluids all the time, and it is especially happened after the vaccination that has happened. Skin is greasy, oily eruption, hair is excessively oily. You see the similar picture in Natrum muriaticum, and now you find it in Malandrinum. Pustules are slow to develop and never ending, as one healed after another appeared. We see this in Heparsulf, Sorinum, Graphitis, and now you have this Malandrinum also in your mind to be impressed upon and keep in mind for a prescription. Next you have is for bad effects of vaccination. Everywhere it is written, Burnett says that there is slow pustulation, never healed one after the other. Clark says that he has cured cases of unhealthy or dry skin which has remained after vaccination, smallpox, impetigo. And Thompson, someone named as Thompson, has cured lot of patients of eczema facialis, oozing viscid fluid, intense burning, much edema, and small scale exfoliated, aggravated from bathing at night and better in cold air. Opposite modalities as that of Miserium. And you have boils and malignant pustules which should indicate melandrinum for you. So Malandrinum in all is a remedy which you should think of in prescribing in cases where you seem to have a picture of thuja, cilicia, or in the gastric sphere you will have a picture of aloes, protontic, sulfur-like elements, and especially the ailments from vaccination is there. Ailments from, especially if it is far back, like 10 years ago, 15 years ago it has started, is very difficult to elicit in patients. And I'll tell you tips on how you can elicit those things which are far back in the history if you stay tuned to this page. So that's all about Malandrinum, and if you think this has helped you, do share in the comments below so that I know that something is working out for every homeopath over there. Glad to see Dr. Akshay Patwa, who was there in earlier of our sessions, and some new people who have uh, joined Depth of Homeopathy, Dr. Nivedita, etc., etc. on Instagram and Facebook. We have on YouTube. We have many people. Can't see their names, but glad to see everyone. And drop in a comment once you know that you have seen this video and it has helped you and given a thought for such presence of symptoms. Melandrinum can be thought of.